All right. Hello again. Thank you for joining us for CompCare for the series for improving practice profitability. Today, we're covering the creating effective treatment presentations and financial arrangements. I know that everybody had questions about the financial arrangements, so here we go. If you missed it on CompCare 1, 2, or 3, you can catch those on YouTube. They're uploaded now, so you can view those when you have a minute. But go watch those and then circle back here because this builds on a lot of that information. So diving right in, we are Mint Conceptions. We are business strategists. We're dedicated to delivering tailored services that meet your unique business needs. That could be anything from coaching, business development, or administrative support services. We have outsourcing options. What sets us apart for you guys in particular is we have a heavy background in dentistry. So we bring a lot of knowledge that can help support your practices in that way. So, who am I? As we've covered before, I am Ashley Boaz. I've been in dentistry for over 25 years. I've been a hygienist for the last 16. I went with my mom to a orthodontic appointment when I was a child, and I thought it was the coolest thing ever. I was sold I was going to be in dentistry for the rest of my life, and so far that has proven true. I've worked in most every position in the office, so I have a good idea of what's going on in your practice and the pain points that you deal with on the day in, day out. And so as the years progressed, my career changed as they often do, but it always circled back to dentistry. This is kind of my passion. So I thank you for letting me share this with you today. This field has given me a lot over the years, so the CompCare series was one of my ways of giving back. So for this course in particular, it covers improving your patient communication and having a better conversation with them using emotional intelligence, educating them in trust building techniques. So you're going to learn strategies that'll increase your treatment acceptance, how to manage those financial discussions, utilizing empathy, and create those lasting patient relationships. So we're going to understand the role of emotional intelligence and how it plays into the patient care. We all think we have great bedside manner, but there's a difference in that and really building a relationship with your patient. We're going to differentiate between selling and educating. We're going to develop personalized patient connections and confidently manage those financial discussions when the time comes. We're going to integrate emotional intelligence, education, and financial transparency to increase patient trust and loyalty. We're going to create action plans for practice improvement when we're all said and done. So the target audience is really anybody in the dental field. However, business is business is business at the end of the day. So there's a lot of concepts in here that can be applied to lots of different industries. So feel free to watch this. If you're not in dentistry, it can still help you. All right. So we've got our agenda lined up. We've got the effective communication, emotional intelligence, psychology of selling, creating patient connections that last, financial conversations, integrating your skills into daily practice. And at the end, we'll have a little bit of Q&A where we have some reflection time. All right. So communication is the foundation to building these relationships with your patients. So, in today's fast paced dental practice, communication is that foundation for long term loyalty. We have to ensure that our patients feel understood and valued, and that enhances the overall experience, encourages them to come back to you. They trust you, they believe the care they're receiving is important and valuable. So, this presentation dives into the three key strategies that can transform patient interactions regarding treatment plans and financial arrangements. So, emotional intelligence, understanding the psychology of selling, and building those lasting connections. So, when these are applied effectively, the strategies can improve your patient acceptance of treatment plans and ensure a smoother financial conversation. So, we need to understand emotional intelligence in dental care. And a lot of times, I think we lose this because we get stuck in our heads about the treatment. But emotional intelligence is really the ability to recognize and understand and manage our emotions as well as the emotions of others. So, in a clinical setting, this means being mindful of not only what we say, but how we say it. And why this matters is patients often come in with anxiety, confusion, or hesitance about treatment and their own personal finances. This is a stressor for them to even be in your practice. So, a provider's ability to connect and emotionally um, be there for a patient can alleviate a lot of this anxiety and build trust and increase your case acceptance. So, the key components for developing that emotional intelligence with your patients for better patient outcomes and lasting partnerships, you're going to have some self awareness. So, you have to understand your own emotional state, and this helps you stay calm and focused during difficult conversations. Always taking that breather before you step in the room and start to have a conversation with a patient so that you don't come in with the stressors from the last patient you were just in with, or business ops mess, or the patient in the lobby. Take a breather before you step in. You got to be self aware and kind of checked in with yourself so that you can be checked in with them. You're going to develop that empathy. So, this is the cornerstone of emotional intelligence in patient care. So, by genuinely putting ourselves in the patient's shoes, we can address their concerns more effectively. You have to kind of understand where they're at and where they're coming to you from. They may have financial concerns, cosmetic concerns, emotional concerns. So we have to take a minute and pretend we were them. How would we feel in the situation? How would we feel if someone said to us what we're going to say to them? You're going to practice that active listening so that you can put yourself in their shoes. You listen to understand, not just respond. This shows patients that um, their feelings are valid and their concerns matter, and helps them feel heard and supported during the appointment so that they're open and receptive to what you're going to offer as help. So, in practical application, it just boils down to be a kind human. Ask open ended questions to explore their concerns. If this was your mother, what would you do? Let's assume you like your mother and you're going to ask questions. You're going to ask more clarifying questions to see how you can help this person on a one on one level. You're going to acknowledge their fears and understand where they're coming from. Use phrases like, I understand this can be overwhelming. I understand what you're thinking, why you're thinking this. I understand how you feel. I've been in a similar situation. Anything that you can help bridge that gap between you as a provider and them as a patient will help build that relationship. So you're going to adapt your approach to your individual patient's emotional states. Some may need reassurance, others prefer the clear cut facts. That's not just their emotional state, it's also how they like to communicate. So, some patients, if you have one that just talks, 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 they probably like a lot of information. So they're going to want more information from you about what's going on. So if you can give them back that, they're going to feel like you value them more because you're communicating on their level. Same thing with someone who's a little more cut and dry. They like the clear cut facts. They want to know the details minimally, just bare bones. What do I need to know? What's the right answer? Those people are a little more direct in their approach. They prefer someone to communicate a little more directly with them. So be mindful of that in your communications with patients and trying to adapt your style to match theirs. They're going to be more responsive to you that way. So, with that, we're going to dive into understanding the psychology of selling. A lot of times we don't want to think that what we do in dentistry is selling, but literally everything is selling. If you have a service, product, whatever that you need money for, you are selling it. So, you have to do it well. So people buy with emotion and justify with logic. And a lot of times we're left at this crossroads of wants and needs. I have this slide in every one of the presentations because we're always at this crossroads. And you have to educate your patients accordingly by understanding the difference in the two and marrying them. You got to shift your point of view. You have to understand the patient wants in relation to their health needs and frame your conversations in that regard. So you focus on their stated struggles, the impact, and the emotional and physical well being issues that help build that emotional treatment value connection. So, for example, if they need a crown, it's going to help you chew again, or smile in photos, or resolve the pain. We can prevent this from progressing any further. We definitely want to avoid a root canal or tooth loss if that's important to them. Um, Incorporating these key phrases when you're doing your handoffs between team members for treatment presentations is really important because it helps keep the focus on the emotional drivers that cause that patient to say yes. So instead of focusing on selling, we have to focus on educating. And that's why we do that emotional driver. We educate them on the health benefits, but it's not just the health benefits. Emotions play a big role in why we do or don't buy things. And understanding their emotional negative mindsets about things that are going on in their life right now help you gear your treatment conversations towards positive outcomes, positive emotions. You're going to feel so much better in the future. You're going to be able to smile at that wedding. We're going to get you out of pain. Positive focused is going to drive a little bit more buy-in. So instead of saying something like you need this crown because it's the best option, and it seems very much like because I said so to them, you would say something more like this crown will help protect your tooth from further damage, which could otherwise lead to more complex issues such as maybe a root canal or losing the tooth entirely. So if they understand a little more about what's going on instead of just because I said so, they're more likely to buy in. People want to make their own decisions in their life. They want to feel like they have some autonomy in that decision making process. So, to build that trust, it's the foundation really in the patient decision making. They're not going to buy anything from people they don't trust. So, patients need to believe that you have their best interests at heart, not just a financial incentive. Consistency, transparency, and honesty and communication build this trust over time. So being transparent. This is on all fronts. You want to be upfront about potential costs and the reasons behind your treatment recommendations. You want to avoid those surprises later. It increases your credibility because you explain treatments in a way that highlight your expertise but remain accessible to the patient by using layman's terms terminology, something they can understand. You want to be on their level. If you're communicating in a way that they don't understand, too technical of terminology, you can lose trust that way because they're not sure they understood what you recommended in the first place. So, we're going to also encourage patient ownership. When we inform and educate, we leave it more in their ballpark to make a decision. It gives them that autonomy back. So, we're going to give patients the opportunity to evaluate their options. Avoid presenting treatments in a rigid manner. Instead, guide them toward making an informed choice. So they're more likely to accept treatment when they feel ownership over that decision. Present treatment options in a way that encourages them to ask questions and engage in the process. So when you go through your Q&A session with them about what they'd like to see the outcome be, do they prefer a denture? Do they prefer a bridge? Do you care if you have something removable or permanent? Having those conversations with them, they kind of already have an idea coming in what they were looking for out of that appointment. So you can help guide them with their options and they can make a decision on their own when they have all of the information. So you're going to work to create those lasting connections. It's one of the most effective ways to build long-lasting relationships is to create a personalized experience for each patient. This also helps drive referrals, repeat customers. It really doesn't matter the industry. Creating lasting connections is sometimes a lifetime customer because you have built into that relationship and built the trust. So to do that, very simple. Remember details about their last visit, like a family event or a concern they had. Address them by name and personalize your treatment discussions based on their unique circumstances. Some things won't work for everyone, but if you understand where they're at and you meet them there, it fosters loyalty. Patients will feel more valued and they're more likely to accept treatment because they're being cared for by someone who truly knows and values them. At least that's their impression. We know we have a million patients on our plate. We're not going to remember everything. Make little notes. Have a little cheat sheet in your chart somewhere that you can take a peek at and see those little notes about special events that were happening for them. It could be as simple as a vacation, a wedding, an upcoming grandbaby. Having all of those little details helps your team create and build these relationships over time. Now, we talked about follow-ups on the last CompCare. This one, we're just going to briefly touch on the follow-up communication because this is another building trust point. It doesn't end when the appointment does. going to just disappear. You're wanting to implement a system of follow up calls, texts, emails after a procedure. That way, the patient feels like they actually care. How am I doing after this procedure? How did things go? Great. Even if it's just a quality check in that you want to see how they're doing. How did things go with your hygienist? How was your assistant? Doesn't really matter. It makes them feel valued and their feedback valued. Um, the other part of that is making sure they have an appointment on the schedule. When you have those constant touch points of outreach, of follow up, getting them back on the schedule, oh, I remembered that you needed to come in and see us again. Those I remembered you moments help build that relationship with them. It helps them feel like you value them as a patient. Um, Same thing with customers. It doesn't matter if it's dentistry. It doesn't matter if it's car sales. Those touch points of, hey, I remembered you. Just reaching out, that helps build a long term relationship. All right. So we're going to do our financial conversations always from a place of empathy and transparency. And the timing is key on these. So you want to avoid discussing costs too early before the patient fully understands their treatment plan. Once the patient recognizes the value of the recommended care, financial conversations become less about the dollar amount and more about how they can afford the treatment. So that's really a key component is timing when you have that conversation. You have to have had just enough education that they feel like they understand what they're doing, and where they want to go with it and what choices they want to make. And then you can have those financial conversations because they understand the value of what they're choosing. You also want to offer flexible solutions. I think most of us out there do have some sort of financial arrangement available for our patients, but there are lots of payment plans, third party financing. Um, you offering these services in house, the ability to apply them or networking with these companies demonstrates your willingness to work with patients so that they can get the care they need. Um, so be willing to discuss these alternative treatment options as well. If costs are truly a barrier to care, you want to make sure they're getting something, that they're not just out there in pain or with massive decay. After you've figured out what financing solutions they do or don't have, make their health a priority and figure out how they that you can help them and talk through that with them. You may have to revise your treatment plan. I know a lot of us do. Don't don't be, stalwart stuck on what it needs to be for ideal. Really, the best thing is what's best for them. So if we can get them healthy, great. So let's try and do that. It may not be, the Maserati. It may be the Honda Civic that we're walking out with, but at least they are healthy. So by integrating all of these emotional intelligence pieces and the psychology of selling, um, you can personalize your patient interactions and create a more trusting and loyal patient base. And it's not just going to lead to higher treatment acceptance, but it also paves the way for those smoother financial conversations in general. It doesn't matter if it's front end when you're dealing with billing, like how the insurance is going to operate, or back in after the fact billing. It makes it easier to have those conversations because it builds the trust. So make the entire patient experience a little more positive and fulfilling by understanding those emotional needs and drivers for patients and why they have the apprehensions and fears that they do have about coming to the dentist. So when patients feel heard, valued, and confident in their care, they're more likely to invest in their dental health and remain loyal to your practice. And the best marketing is the marketing you never had to do, right? So those repeat patients, they refer patients. Those are our best patients, right? All right, so it's your turn. You want to name one missed opportunity from this week, um, where you want to create a lasting impression. So if that didn't happen with one of your patients, who was it? How did it go? What can we do differently? What can we do now that they're gone? They've already left our practice. How can we turn this around? Maybe it's those follow-ups. Maybe it's a thank you letter. There are lots of ways that you can help build that relationship with the patient and bring the focus on their care instead of just the money aspect. How many times do we hear about patients that are upset? They feel like I'm just funding your yacht, right? And that we know that's not the case. But it's because that relationship wasn't built in a way that made the patient feel like they could trust you. So which patient this week do you feel like you missed that opportunity with, and how can things be done differently? think through these. There may be a couple that you guys can do a case study with your team on how to do it differently next time, but definitely take a few minutes to work through this for yourself before discussing with your team. And then any questions you have, please drop them in the chat. Happy to answer them. I'm here to help build value for your practice. So however that unfolds, I'm happy to assist. We have our other CompCare webinars like I was discussing earlier. If you've missed those, they are on YouTube. So check those out. And then I want to thank you for allowing me to share my passion with you. Dentistry is my passion. So I appreciate your time. And if you guys are interested in working with us, you can contact us here. And again, any questions, you can drop them in the email, you can drop them in the chat. Happy to answer them. Just want to build value for your practice. And I hope you guys enjoyed.